Hello everybody, and welcome to my senior seminar presentation on lily toxicity. I chose this topic because it is my goal to subject everyone I know to veterinary medicine, as I have been subjected to human medicine during my undergraduate career and basically my entire life. Here's a quick overview of what we're going to be covering today. We're going to start off by talking about who lilies are toxic to, then we're going to move into a background on lilies. Finally, we're going to finish up with all the information that you need to know about lily toxicity, what it causes, how it functions, how to recognize it, treatment, and anything else that you might need to know about lily toxicity. The first question you might have is, who are lilies toxic to? All species of lilies are toxic to Felis catus, the domestic cat, while a few specific species are toxic to Canis lupus familiaris, the domestic dog. Let's play a quick game just to make sure everyone knows what a cat is. Feel free to shout out your answers. This is a cat. This is my cat Mishka. This is a dog. This is my dog Astro. This is another dog. This is my dog Cafe. Here's a cat. This is my cat Griffin. Here's another dog. This is my dog Cupid, who, if you have been following my journey with my dog Cupid, he was the one last year who was ran over by a truck and drug under the truck for 12 feet. We have at this point made a full recovery, thankfully. If you were in any of my classes with me last semester, you know that this was a rough journey for me. This is my dog Hermione. This is my cat. Her name is Ravenclaw. This is another dog of mine. Her name is Venus. This is another dog. His name is Godzuki. Here's my other cat. Her name is Luna. And so if you were keeping track, yes, I do indeed have 10 pets. So let's talk about lilies. They belong to the kingdom of plants. Their order is Liliales. The genus is Lilium, and they belong to the family Liliaceae. We commonly refer to them as lilies. There are 80 to 100 different species of lilies. Some common lilies that you might recognize are Easter lilies, tiger lilies, Asian lilies, stargazer lilies, but all of them are toxic. But how can you recognize that a flower is a lily? The common name lily refers to herbaceous flowering plants within the genus Lilium. These plants are prized ornamental plants that have been extensively hybridized. The true lilies are erect perennial plants that have leafy stems, scaly bulbs, usually narrow leaves, and solitary or clustered flowers. The flower of the plant consists of 6 petal-like segments, which can take several forms. These forms include trumpet, turban, bowl-shaped, and tubule. Here you can see an example of a trumpet-like lily. This one is called the Easter lily. Here is an example of a turban lily. That is a tiger lily. And here is a tubule lily. This one is a calla lily. Some flowers are fragrant, while others are not. Lilies range in size, but on average are 1 to 4 foot tall. They come in a wide variety of colors due to their extensive hybridization. Where can you find lilies? Lilies are native to temperate areas of the northern hemisphere, such as Asia, Europe, and North America. They are widespread. In the home, you can find lilies in floral bouquets, at funerals, at various holiday celebrations, and now in home gardens. They were originally very difficult to cultivate, but thanks to John de Groff's experimentation with lilies, lilies were now accessible to the public. According to Horticulture magazine in 1941, Dr. John de Groff created the most famous hybrid of lily of all time, that you and I know as the Easter lily. If you'd like to raise some lilies of your own, you might like to know that most lilies are raised from bulbs, and most of them bloom in July or August. Here you can see a picture of an ofrenda, which is part of a traditional holiday in Mexico known as Dia de los Muertos. On the ofrenda, you can find a few different species of lilies, along with the traditional marigolds. Families spread the petals of these flowers from the grave site back to the ofrenda. It is said that the ghosts use these petals as a walkway to visit their family members during this special celebration. So let's talk about some other ways that these flowers are culturally significant. The lily is referenced in both the New and Old Testament several times. Within Christianity, lilies are used as a symbol of purity and chastity. In Catholicism, the Virgin Mary is often associated with lilies. This is why often at the foot of Mary you can find lilies in statues and paintings. They are also used as a representation of death and the loss of innocent children, along with the martyrdom of saints. In Greek mythology, the lily is considered to be the flower of Hera, the wife of Zeus. The flower was supposedly formed from her breast milk. Here you can see a painting by Gustave Moreau called The Peacock Complaining to Hera. There are some lilies peeking out behind the peacock's feathers. In Roman mythology, Venus, the goddess of beauty, was supposedly so jealous of the flower's white loveliness that she caused a huge pistil to grow from its center. In Chinese culture, lilies are used as wedding flowers. They are supposed to grant the couple 100 years of love. The next time that you think about purchasing a bouquet of lilies, you might want to consider their color significance. White refers to purity and virtue. Yellow refers to thankfulness and the desire for enjoyment. Pink for prosperity, abundance, and love. Red for passion and sexuality. And finally, orange for confidence, pride, and wealth. Lilies are among the oldest cultivated plants. Because of this, they have a few different culinary uses. Lily bulbs contain starch and have long since been used in cooking in China. Because they are full of starch, Native Americans use the wood lily as a thickener for soup. Lilies are commonly used to garnish cocktails. Speaking of cocktails, the Oaks lily is the official drink of the Kentucky Oaks. The Kentucky Oaks is a Grade 1 stakes race for 3-year-old thoroughbred fillies that is held the Friday before the Kentucky Derby. The official drink was inspired by the stargazer lilies draped over the winning filly's shoulders. Lilies have little to no pharmaceutical value. During the Elizabethan era, medical texts recommended using lilies to treat fever, wounds, and arthritis. Lilies were once considered to have magical properties. During the 16th century, tea made from the roots of lilies was used for morning sickness. Lily root was also added to wine to stimulate memory and focus. Let's finally talk about how the lily is toxic. The entire plant is toxic, including the flower, the stem, the pollen of the plant, and the leaves. Even the water that is in a vase of lily flowers has been known to kill cats. Lilies are nephrotoxic to cats. This means that they cause them to die of kidney failure. They can develop fatal kidney failure in less than 3 days after initial ingestion of the plant. The toxicokinetics is currently not well understood, but we do know that there is a rapid onset. This suggests that the absorption of the toxin is quite rapid. The known mechanism of action revolves around the renal tubular epithelial cells. The precise mechanism of this is unknown. This epithelial damage results in the sloughing off of the tubular cells, ultimately leading to the kidney failure. These cells can be observed in the urine. Because the mechanism of action and toxicokinetics of this toxicity is not well understood, it is clear and evident that more research needs to be performed. The issue with performing this research, however, is that because the toxicity of lilies is unique to cats, it makes it difficult to find ethical ways to study this toxicity. Let's get clinical. How are veterinarians diagnosing this? Many cats have a stress leukogram as the only CBC finding. For those of you that don't know, CBC stands for complete blood count. In early serum biochemistries, moderate to severe increase in blood urea nitrogen, creatinine, phosphorus, and potassium can be observed. A diagnostic marker of this toxicity is disproportionate increase in creatinine as compared to blood urea nitrogen after verification of plant ingestion. A urinalysis can provide evidence of renal damage even before the serum chemistry changes. This can be seen as glucosuria and proteinuria. Pulmonary, hepatic, and renal lesions are commonly identified with histopathological evaluation. Diffuse acute renal tubular necrosis is the most prominent lesion found. Granular and hyaline casts are commonly observed in the collecting ducts. In all of these cases, the basement membrane is found to be intact, and mitotic figures are often present. Empty GI tracts and swollen kidneys with abundant perirenal edema have been found in all cases upon post-mortem assessment. So let's talk about how to recognize if your cat has been poisoned by a lily. Early signs can be viewed within the first 12 hours after ingestion. These signs include lethargy, drooling, vomiting, loss of appetite, depression, polydipsia, which is an increased intake of water, and or refusal of food and water. The initial drooling and vomiting usually subside within 4 to 6 hours. This leads to owners and veterinarians believing that a cat is recovering from a mild gastrointestinal upset and can result in the delay of appropriate treatment. Signs of kidney damage can be seen within the first day after initial ingestion. These signs include increased urination, dehydration, muscle weakness, and seizures. If left untreated past 18 hours, this kidney damage will be irreversible, leaving your cat in need of post-maintenance care for the rest of their life, assuming that they survive the poisoning in the first place. To check for dehydration in a cat, you can tint the skin on the back of the cat. If it snaps back quickly, the cat is well hydrated. If it stays tinted or snaps back slowly, this is a sign of dehydration. If your animal ingests a poison, you should call the Poison Pet Helpline or the ASPCA Animal Poison Control Center. I have listed their phone numbers and websites here. If you have a local animal emergency center, you may take your animal there. If you're going to go to the emergency center, I suggest calling ahead. Bring the poisoning agent with you if you can, or take a photo with your cell phone to show the veterinarian. This is good general blanket information for you should your pet come into contact with any kind of toxic agent. By bringing the toxic agent or taking a photo of the toxic agent, it better helps the veterinarian understand how much of the agent was ingested and or what exactly the agent is. I recently had to call the ASPCA Animal Poison Control Center after my dog ate my medicine. Here you can see a picture of the medicine that he ate. The ASPCA Animal Poison Control informed me that he would be fine. The only issue with ingesting that medication would have been a teratogenic effect. I don't think he's going to have babies anytime soon, so I think we will be okay. I hope that by sharing my story, you will understand that accidents do happen, and I encourage you not to feel embarrassed if such an accident happens in your home. So your cat has ingested a lily. How are we going to treat it? Early intervention is key. If you believe that your cat has ingested a lily, take them to the animal hospital as quickly as possible. For treatment of lily ingestion, the veterinarian will perform decontamination. Essentially what this is induced vomiting. To prevent dehydration, the veterinarian will also perform fluid therapy. Dialysis may be needed depending upon the amount of kidney damage. The best prevention is total avoidance of exposure. If you have cats in your house, please do not keep lilies in your home. Interestingly, all cats that have been observed with lily toxicity have been exclusively indoor cats. It is believed that this may be due to outdoor cats selectively chewing on other available green plants instead of these toxic plants. Thus, exposure to outdoor plants in these genera theoretically would be of lower risk for poisoning to exclusively outdoor cats. I propose that theory to be incorrect. Instead, I believe that outdoor cats are poisoned by this genera of plant, but they are not found and have not had necropsies performed on them to provide suggested evidence of the lily toxic poisoning. One thing that I want to make sure you understand is that without treatment, this toxicosis is 100% fatal. I believe it would be negligent of us to discuss lily toxicity in cats without discussing the current trends in veterinary toxicology. The most common cause of toxicosis in cats is not lilies, but is insecticides. People spray them on surfaces in their homes and outside in their gardens. Then the cats run about, getting the insecticide all over them, later licking it off of themselves. Some may find it surprising that the most common cause of toxicosis in dogs is not chocolate, though xylitol and chocolate are both toxic to cats and dogs and account for a large number of toxicology cases. The most common cause of toxicosis in dogs is actually ibuprofen. People have been giving their dogs ibuprofen as pain relief without veterinarian guidance. Ibuprofen is hepatotoxic to dogs. Their livers are unable to chemically convert ibuprofen as quickly as we can, leading the drug to build up to dangerous levels in their bodies. It shouldn't come as a surprise that human medications are a top reason that animals visit the animal ER. Toxicology reports due to ingestion of depression medications are on the rise. Ingestion of marijuana in any form is also on the rise. I personally have seen several dogs at the ER that have ingested marijuana. The patient typically presents with uncontrollable urination, being the primary reason that the owners bring them in. If you take dietary supplements, please be careful about your vitamin D. Both cats and dogs have a tendency to eat them because they taste sweet. This leads to hypercalcemia. On the right, you can see that I have included a Pie chart of personal observations I have made of toxicology cases at the animal ER. If you take a close look, interestingly, you'll notice that I have seen 0 dogs poisoned by chocolate. However, I have seen several dogs come in after eating medication. I've seen 2 animals come in after eating rat poison, which if you don't know how rat poison works as an anticoagulant, causing animals to bleed to death. I've seen several animals come in after ingesting insecticides and over-the-counter medicines like ibuprofen. Unfortunately, I have also seen many animals come in after ingesting marijuana or being bitten by snakes. Strangely, I've also seen a large amount of animals who have come in that have swallowed batteries. So far, I have not seen a cat come in with lily toxicosis. After making this video, I hope that if a cat comes in after ingesting a lily, that I would be able to recognize the signs of lily toxicosis, that you after watching this video would be able to recognize the signs of lily toxicosis in your pet, and that later on, after I became a veterinarian, that I would be able to prevent kidney damage if possible in these patients. Here is a list of my references. I hope that you enjoyed my video and found it informative.